we're going to continue our conversation of blood loss and kind of thinking back to the three types of anemia. I did mention before that sometimes severity can give you a clue. The severity of the anemia can give you a clue as the type of the anemia, and that's not true with blood loss because it's very variable, and that means that it ranges from mild to severe. Now, the location of the blood loss can help us because, of course, if it's external, it's much easier to see. Then we can have internal blood loss. And so when we talk about external blood loss, you can have GI bleeding, and that can be things like frank blood, which is called hematochezia, or blood, sort of very bloody diarrhea, or you can have dark tarry stools, that's called melena or melena. You can have epistaxis, which is bleeding from the nose. You can have bleeding in your urinary tract, which is called hematuria. And then you can have all sorts of wee little creatures on you, such as fleas and ticks, that cause external hemorrhage and blood loss. So those are some external causes. There's also internal causes, and of course we talked about hemoabdomen today in class. But you can have hemothorax, and you can even have anemia, blood loss around the heart, so pericardial blood loss. But other places, such as within the brain, is usually pretty life-limiting. We also talk about the duration of the blood loss. So first severity, then location, is it internal, external, and the duration of the blood loss is relevant because that's going to impact our clinical signs. So we've talked about the clinical signs related to acute blood loss. And this is where you have that sudden drop in PCV, and your patient is clinical for it. So they may collapse or be lethargic or any of those things that we kind of already talked about. Chronic anemia is a little bit different, and I'm going to tell you about that now. With chronic anemia, your red cells have time to adapt to this lack of oxygen, and so they actually increase production of that thing you probably learned in biochemistry called 2,3-DPG. I'm not going to test you on that. And when 2,3-DPG increases in red cells, it allows them to increase their oxygen delivery to the tissues. That means it alters that hemoglobin oxygen binding, and it increases that tissue delivery of oxygen. What does this mean? This means that your clinical signs are going to develop later. So we're in acute anemia or acute type of development of anemia, whether it be blood loss or any mechanism, internal or external. It may be a more sudden onset of clinical signs, but with chronic anemia, it tends to be a slower onset. So an animal might have a lower PCV before you see the same clinical signs. So back to kind of all of the blood loss. So with acute blood loss that is external, so that's this guy over here, the blood's lost from the body, but usually the patient's going to recover or potentially doesn't recover. So the long-term effects of losing blood that contains iron, which is where we're getting to, that's okay because, again, the animal's either going to recover or they're not going to recover. And then the blood loss isn't going to be as relevant in terms of iron loss. With internal blood loss, all of the hemoglobin in heme it stays within the body. And so any iron that's in those red cells is going to be recycled, more so the heme portion of the hemoglobin. Now with long-term external, so internal could be acute or chronic and everything stays in there, meaning all the iron stays in the body and is recycled. But with long-term external blood loss, eventually all of these hemoglobin molecules containing iron leave the body and then you become iron depleted. So with long-term external blood loss, we can actually sometimes identify this on a CBC. So just to tell you a little bit about iron and hemoglobin, so if you remember back to some class in the previous, many years of your education, Iron's a part of all hemoglobin molecules. It's actually the center of the hemoglobin molecule, meaning that iron's an absolute necessity of hemoglobin because that's the backbone of hemoglobin. And so then iron is an absolute necessity of red cell production because red cells contain a lot of hemoglobin. We're talking about hundreds and thousands and millions of hemoglobin units per red blood cell, which is, of course, what makes it red. So without iron, there is no hemoglobin, and so then there are no red cells being produced. So most of the iron in our patients actually comes from recycled red blood cells. So that's where most of it comes from. And then very little comes from the diet, depending on the type of diet you have. So most iron comes from red blood cells, and not a lot really comes from diet, a very small amount. So the significance of that is that nutritional iron deficiency is very, very uncommon unless you had a patient or an animal who had a lower PCV to start with less iron. And who's that? Young animals. So young animals that are on a milk diet, they tend to have less iron anyway, and so they're more at risk for dietary iron deficiency. But in adults, that's very, very uncommon. What's more common is chronic external blood loss leading to iron deficiency. So remembering back a little bit to erythropoiesis, iron's an absolute necessity of red cell production, and a sufficient amount in erythropoiesis actually stops the divisions of red cells after that fourth division. So without a sufficient iron, you get a fifth division, which results in a smaller red blood cell that eventually has less hemoglobin because it has less iron. And so that resulting cell is smaller and paler, and those can be called microcytes, although not all are microcytes. So let's talk about that. So with, again, iron deficiency, you get less hemoglobin per cell, and you get that extra division because of the lack of iron and the lack of hemoglobin. So what does that cause? When you have sufficient numbers, you have smaller cells, which is a decreased MCV, which you may see when you look at a slide, small pale cells, which are called microcytes. You have pale cells, which have less hemoglobin, again, so you have a decreased MCHC, and this may correspond, when you look at the slide, to something called hypochromasia. And so you see a microcytic hypochromic anemia being characteristic of iron deficiency. So again, a microcytic hypochromic anemia is characteristic of iron deficiency. These can be regenerative or they can be non-regenerative. And it's a little complicated, and I'm not going to go through a lot of this. It's not entirely understood because there's multiple mechanisms, but it's thought that it depends on the duration and severity of the blood loss and the remaining amount of iron in the body. But we're not going to differentiate this. So regenerative versus non-regenerative isn't going to tell you that it's necessarily iron deficiency or not. This is the one case where the indices are extremely important. And this means that you can even have a regenerative anemia, but our MCV is decreased because the cells are all small. So characteristic features of iron deficiency when we look at blood work. So our PCV or hematocrit, obviously we expect there to be anemia. It can be very severe or not as severe. We have a decreased MCV, we have a decreased MCHC. Retics, they can be normal or they can be increased. And then morphology, we can see microcytes, which are small pale cells. We can see hypochromasia. And then we can see characteristic changes such as schistocytes, so you can see schistocytes, keratocytes, and acanthocytes, and in the face of a decreased MCV and decreased MCHC, the presence of these cells indicate red cell damage because the red cells are iron poor and very fragile. I'm going to actually do a separate video explaining that. Platelets are increased, and that's a reactive cause due to the anemia. So causes of iron deficiency, chronic external blood loss, most commonly is going to be GI. So in a young animal, you're going to think parasites, maybe hookworms. In an older animal, maybe you'll think neoplasia. You want to check the history to see if they're on some sort of NSAID therapy. Maybe they have ulcers. You always want to look for ectoparasites. This is not that common. I don't know why I start it. And then obviously iatrogenic causes could cause it as well.